Hello, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, Austell. And this month, the month of March, is National Kidney Awareness Month. So what I'd like to do is real quickly go through a brief presentation I've compiled on kidney anatomy, just a basic kidney anatomy lecture. I'd like to talk about some of the stuff that can go wrong with the kidneys, as well as the kidneys' impact on other systems. And then I'd like to go into just some kidney awareness, life strategies, that sort of thing, not only to draw awareness to it because it is National Kidney Awareness Month, but to help encourage those listening to make healthy life choices and a prolonged, active, long-term life plan. So again, I'd like to first go through the kidney-associated disorders. I'd like to go through the kidney anatomy. Excuse me for just a second. Okay, so kidney anatomy. The kidney, as many people know, is a bean-shaped organ that's located in the middle of your body, more towards the back. Normally there's two kidneys. Now, certain situations can happen where one is underdeveloped or not present or congenital defects. But in a normal, healthy adult, the adult has two kidneys. So what I'm going to do is I'm going to utilize my cursor on the screen here to outline the kidney shape and then talk about just generally the structure of the kidney. So the renal artery, some background on arteries and veins. An artery delivers fresh oxygenated blood that's got good nutrients to the body, to different vital organs. The kidney is considered a vital organ. So this red, I'm using my cursor to outline it. This red is the renal artery. The function of the renal artery is to supply from the rest of the body, pumping from the heart, blood to the outer structure of the kidney. The kidney essentially works outside in. And this is a complicated structure, but it's an efficient filter. So the renal artery delivers blood to the outside region called the renal cortex. That's one of our other structures, but we'll get into that. So as a review, the renal artery delivers oxygenated blood with healthy, fresh nutrients to allow the kidney to function properly. So once that blood has been delivered, then you have the renal vein, which is represented by the blue structure here. The renal vein takes up bad metabolites and the deoxygenated blood and delivers it back through the renal vein all the way to the rest of the body, back to the heart. So it's a flow in and a flow out. That is the renal vein. The renal pelvis. So the renal pelvis is essentially a collecting structure. So once your blood has delivered to the kidney and the kidney has filtered the blood, that filtered substance has to go somewhere so it can be excreted from the body. So the renal pelvis is this big open region here that, consider it a funnel. So it takes all the nutrients and everything and the metabolites that have been filtered from the kidneys and allows it to go through, it's not listed on here, but the ureter, which then can be filtered and excreted from the body. Renal pyramid. So imagine a pyramid. A pyramid is a triangular structure. Essentially, the renal pyramid is this functional unit here. The renal medulla. The renal medulla, if you can see this red part here, that's essentially the renal medulla. It's a functional structure along with the renal cortex. The kidney is a unique structure in that it allows for a very, very fine balance of filtering nutrients, filtering waste products, and also maintaining your blood's pH, its acidity level. Normally, you have an acidity of about 7.4 or so. If you've ever heard of the pH scale, same as like a pool, not the same pH, but it's the same mechanism. So this structure, within this structure are tiny microscopic functional units called the nephron. And the nephron allows for that filtering process to occur. I'm not going to go into the nephron. You just need to know that it's a functional structure that's microscopic within the kidneys that filters all these fine capillaries into the calyx, this area, and then the renal pelvis. So that's essentially the anatomy of the structure. So, let's move on to renal flow. So renal flow, I found this picture on the internet. It's just a stock image. So this is a review. As the body filters blood, the blood flows from the heart. The heart is constantly pumping blood. And the heart, about 2/3 to 3/4 of the blood can eventually travel through the kidneys. It depends on which person, and people have different flows and that sort of thing. But just know that the heart pumps blood through the body that's been through the lungs and through the digestive system and everything. It goes through the renal artery, up into these capillaries in the cortex. Up in the cortex is the part where the nephron starts. That nephron starts filtering everything. There's little loops here. They're microscopic loops that you can't see. But eventually, the end product of the urine and whatever bad metabolites or waste products are there comes in through the renal calyx, into the renal pelvis, and then out through the ureter in the urethra, the ureter in the urethra. So as that blood is deposited, the blood is not normally filtered through the kidney as far as a waste product. If blood shows up in the kidney, then that's a bad sign. It should be medical attention, should be noted. So as that blood is filtered and it deposits all its waste products, it comes back through this blue, which is the renal vein, and then out through the rest of the body. I wanted a slightly bigger picture just so you could see and visualize that. Okay. So some kidney-associated deficits. Sorry, let me move my face here. Kidney stones. Essentially, as your body is filtering the blood, there's calcium, there's sodium, there's all kinds of other acid and base products that are filtered through the blood. What can happen, though, is if there's not adequate blood flow or not adequate blood pressure, or there's a backup farther downstream where it's dammed up, those metabolites and those acids and calcium and all these other products can cause a backflow up here and deposit and form crystals. And essentially, that's what happens if you've ever had a kidney stone, that's what's happening is there's not adequate flow in or out. So these crystals build up in here in the kidneys, and then it's very painful because they can become large and it's hard for them to process and get out. So if they're small enough, they can break away and then it's painful, but they can be passed through the ureter and the urethra. If they're large enough, then they may require other approaches from a doctor, whether it's through lithotripsy or a surgical approach. That's why having good hydration, having adequate exercise, and a good diet is essential, which we'll keep coming back to that theme, because you're preventing the buildup of those crystals. So normally, in a normal functioning kidney, there's certain products within the kidney itself that prevent those crystals from forming. But sometimes that doesn't work, whether there's not enough volume of fluid or whether those products are not present. It can cause those kidney stones to form. So tangent off of that is fluid and waste buildup. So if you can imagine, so I'm trying to go back to the diagram here. If this area, the functional unit of the kidney, is blocked up, then it can cause a dam, which further upstream can have fluid buildup in the rest of the body. This is a lot of times why people with kidney failure or renal failure are swollen, end up with heart failure, breathing issues, trouble with their blood pressure, because it's not just the kidneys that are affected, the whole body can be affected. This is why the kidneys are considered vital organs, because they affect everything, even the brain. So the heart, lungs, and the brain and associated problems. So as I said, if you've got fluid buildup, your heart has to work harder to pump that fluid through the body to make sure that your muscles, your brain, your other vital organs get adequate pressure and get the nutrients they need to survive. If you're not getting adequate pressure, then eventually your organs are going to die off because, one, they don't have good nutrients and oxygen supplied to them, but also locally in the muscles, the brain, the other vital organs, they can build up bad metabolites and toxins, which can cause harm. Renal failure can eventually lead to full body failure, which it needs to be addressed medically. The lungs. So if you have fluid buildup around the lungs, especially around your chest, it makes your lungs have to work harder against the pressure of the fluid. Also, that fluid, if there's enough pressure and enough of a concentration gradient, that fluid can flow into the lungs, causing pneumonia and all kinds of other problems. Kidney failure is a total body affected mechanism. So it not only affects the kidneys, it affects everywhere. I'm going to keep driving home that point. The brain. So one would not normally think of the brain has any effect on the kidneys, or the kidneys have any effect on the brain. They're far away from each other. They're not normally associated. However, if you've got bad metabolites and toxins floating around in your bloodstream because they're not able to be filtered well by the kidneys, if the kidneys are messed up, then those metabolites, they travel throughout the whole bloodstream, and your bloodstream supplies the brain. If you've got a kidney infection or kidney stones or fluid backup, when those bad metabolites and toxins travel to the brain through the bloodstream, they can affect the brain's ability to process, leading to balance issues, leading to increased confusion, causing hormonal problems. There's a whole backflow that can occur from having kidney-associated brain problems. What's very common, at least I'm a physical therapist by trade in the rehab world, is people who develop a urinary tract infection. One of the most common signs is increased confusion, balance issues, and trouble doing tasks that they normally would be able to do. This can be from very moderate loss to balance and motor function to severe. Now, antibiotics can help, but if it gets bad enough where it leads to sepsis around the whole body, where the bloodstream and the rest of the organs are infected, it can eventually lead to death. That does happen. But that's why if you have any signs of kidney infection or pain or increased confusion, medical attention is needed immediately, just so it doesn't reach that point. And another problem that can be affected through the systemic, the whole body, is blood pressure changes. Now, the blood works as a unit. Blood has a certain level of pressure, it has a certain pH, as I mentioned previously, but there's also certain hormones associated from the brain, the liver, the kidneys that affect your blood pressure. The kidneys in particular have two vital functions in blood pressure. The kidneys secrete a hormone called renin, which helps raise blood pressure. Now, in a normal, healthy adult, renin is important because it allows the heart to work properly. It raises blood pressure to allow for that perfusion to the rest of the vital organs so that the system can operate flawlessly. Now, if you've got kidney damage, obviously the ability to secrete the renin can be compromised, as well as if you've got high blood pressure, that signal to your brain, to your kidneys, and all that to secrete the renin is also compromised. So there's trade-offs. So let's go to the next. What affects the kidneys? Liver failure can affect the kidneys in a couple ways. Liver failure, your liver is another sort of filter. It helps break down and excrete and package toxins and bad metabolites through the rest of your body through blood flow to the liver. Now, if your liver is compromised and not working properly, those toxins eventually, through the renal artery, end up in the kidneys, which can cause damage to the kidneys in turn. The liver also has a role in the blood pressure through the renin, angiotensin, aldosterone system, which I'm not going to go into, but just know it has an important part in blood pressure. An enlarged prostate. In men, this can be a very common problem, whether through prostate cancer and a large prostate. I'm going to go back to my diagram here and move my face. The prostate's farther down in this mechanism, but the prostate can put pressure on the urethra and the ureter and all that and cause a backflow, which, as we mentioned earlier, can lead to enlargement and compromise of these vital functional units of the kidneys, which then in turn can lead to a damming effect and a problem with flow into the kidneys, causing the rest of the body to have a volume overload, which causes the heart to work harder, causes the liver to work harder, causes the lungs to work harder, can affect the brain. That's why an enlarged prostate is a serious issue. Heart failure. Heart failure through volume overload or through pressure problems. When you've got too much fluid throughout the rest of your body, it forces your heart to work harder through the back pressure on the heart, causing not only muscle enlargement, which muscle enlargement you think normally of being a good thing, because if you've got stronger muscles, they're able to hold your body up, your balance is better. But with the heart, it can be a problem because it can lead to a couple issues as far as the efficiency of the heart, for the heart able to fill and the heart able to empty. If you've got too much volume, it can also lead to the heart chambers expanding and not being able for the muscle to contract efficiently. A urinary tract infection. I touched on this a little bit earlier. If you've got a urinary tract infection, I'm using my cursor here, farther downstream, if it's bad enough, those bacteria can travel up through the urethra, into the ureter, and into the functional unit of the kidneys. Not only can that damage the kidneys, but it can lead to, if it's bad enough, where those in the cortex here, the functional unit where the blood flow is distributed, it can travel through the bloodstream into the brain, into the heart, into all your vital organs, and can cause vital organ compromise. So people get urinary tractions all the time, but it's important to know that it needs to be treated immediately. It can be a medical emergency, and people can even die of a serious enough urinary tract infection. So looking for signs is essential. Diabetes, particularly in this country, is a very common problem, difficulty regulating blood sugar. Diabetes effect on the kidneys, that high blood sugar content can affect these functional units of the kidneys, causing damage to them, but it also can cause damage to the blood vessels, these arteries and arterioles and capillaries, which compromise the blood flow to the kidneys. If it's unregulated, it can lead to renal failure. Now, the reason I wanted to talk about the anatomy and the general flow and some of the pathologies that can affect the kidneys and the pathologies to the kidneys that can affect the rest of the body is because it is National Kidney Awareness Month. I wanted you to have a foundation to build upon for strategies to what you can do to affect your kidneys, to improve their status. Okay, let me move my face here so you can read. What can you do to help your kidneys? Activity. I put an exclamation point here to highlight it. Activity is essential. Walking, getting up, moving, positional changes can affect your blood pressure. It can help regulate your blood pressure better. It can help your heart. It can help your alertness. It can help provide positive muscle pump to your kidneys so that they're having adequate flow and can do their job and filter. Activity. People who are sedentary, they're not having good enough blood flow to their kidneys. They're also not allowing blood flow to the rest of their bodies, like their liver, their lymphatic system, which is also a filtering system, to allow those bad metabolites and toxins to be pushed around and secreted out. So activity is essential. Being proactive, walking, even just seated activities can be helpful. Allowing your body to get up and move and reposition. Diet and weight management. There's a couple of reasons diet and weight management are essential. Going back to the diabetes, having good, adequate blood sugar levels, not only too low, but preventing it from being too high, can help prevent the kidneys from being damaged. Also, if you have an active lifestyle and you have managed your weight, you're more likely to be able to get up with less pain, less stress on your vital organs, and less stress on your bones to allow the whole system to work properly. Planning long-term. Planning long-term, this particularly is important, not only for National Kidney Awareness Month, but for your life. Taking these strategies, such as activities, such as good diet management, reducing stress, reducing smoking, fluid and volume management, is what I'm going to keep talking about. Having a long-term plan, not only just implementing those strategies now, but implementing them for the rest of your life to give yourself and give your body the best chance to maintain the word is homeostasis, keeping good fluid management, keeping a good diet, and making sure every vital organ can work properly, making sure your brain can work properly, and being proactive, making sure that if you do have a problem, making sure you see the doctor and it is treated medically before it can become a problem. Reducing stress. So reducing stress has an effect on your blood pressure, but it also has an effect on your brain's hormone secretion, which can affect your whole body. Your brain is essentially the computer that runs everything. And if you've reduced stress, it keeps your body at a natural, comfortable level to allow everything to work. This is through, you can use yoga, you can do calming techniques, even just having a good wellness plan, getting up, having a pattern of movement, having activities to do during the day can all help reduce stress and allow the body to work properly. Reducing smoking. Reducing smoking is essential because it's pretty well known that smoking causes damage to the body. But what's not well understood is, at least by the general population, is the effect that smoking has on your blood pressure and your blood vessels. Smoking, particularly nicotine, has an effect on your blood vessels, which causes a raise in blood pressure. Your blood has certain receptors called nicotinic receptors, which causes constriction of your blood vessels, which then raises your blood pressure. And as we've said previously, if you've got high blood pressure, not only can that damage the little capillaries in the kidneys, but it can affect the kidney's ability to work properly. Fluid and volume management. So there's a couple caveats here. If you've got excess fluid, like you already have renal failure and kidney damage, your doctor may put you on a fluid schedule where you're only allowed to have certain amount of fluids daily to allow your body to efficiently process and manage the concentration of your fluid in your body. Now, that's important because this is why having a long-term plan is essential, because if you take action early and you're aware of the signs and you seek medical attention from whether a consultation from your doctor or other resources, you can have a plan in place to make sure you're keeping enough demand from your kidneys, but not overflowing the fluid. On the other side of that, in a normal, young, healthy adult, it is important to have good, consistent fluid intake. So making sure you're drinking enough water, during the day, not just when you feel thirsty, to allow these kidneys to filter and flow properly. If the kidney is starved of fluid, it will shunt fluid from other areas of the body. Your body has a natural mechanism to do that, but the kidneys can be damaged from not having good blood supply or not having good blood flow through these capillaries and these structures to allow it to function properly. Fluid and volume management is essential. I keep coming home to a point of long-term planning, having an active lifestyle, having diet and weight, and then being aware of, if you do have a problem, be in close coordination with your doctor. Having a good positive mindset is also essential. Kidneys and the vital organs. So the reason I put this particular slide, it can say two things. It can say kidneys and vital organs, or kidneys are vital organs, because the kidneys and kidneys functioning properly are essential to the rest of your body functioning properly. That's the kidneys and vital organs part. But the kidneys are vital organs part is that if the kidneys are affected, they can cause damage, and you could even die. I mean, in long term, you could even die. So the take-home points are good habits, activity, and maintaining a positive and proactive mindset, and about the kidneys and kidney health and whole body health is essential. We're going to go back to activity, weight management, having a positive mindset, reducing stress, making sure blood pressure is regulated, and then making sure proper fluid management, whether it's proper intake of fluid or proper management of fluid if there is a renal problem. Again, March is National Kidney Awareness Month. So the purpose of this month is to draw attention not only to how you can help manage your kidney health, but also active lifestyle changes and techniques that are essential for maintaining your life. And every little bit helps. The reason I say that is, even though we've been talking about long-term management strategies, being proactive now, and even if it's just, not eating so much sugar, or not getting up a little bit more, every little bit every day has an effect. So putting off, okay, I'm going to walk tomorrow, or I'm going to change my diet tomorrow. Well, immediately you're not going to have a problem, but long term, it may lead to some effects down the road. So just being conscious and cognizant that every little bit helps. That doesn't mean that you can't, give yourself a treat every once in a while, but just having a good mindset about the whole kidney and the whole body is essential. Again, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, and I hope you enjoyed this presentation on National Kidney Awareness Month, the anatomy of the kidneys, some of the stuff that can go wrong, not only with the kidneys and the other vital organs, as well as just some strategies and healthy wellness lifestyle changes that just encompass the whole thought of National Kidney Awareness Month. Thank you.